Hi, this is Chandra at Green Tree Chiropractic. So this is the last in the series, kind of giving you an idea of, again, some of the extra education that we get as chiropractors to make sure we're diagnosing musculoskeletal complaints and referring the non-musculoskeletal stuff appropriately back to your GP. So the last one I'm going to show you is a respiratory screen. When people have issues with their lungs, because you've got a lot of lung space in the back, because if you think of it, you've got like the food pipe, your esophagus, you've got the heart, all those things in the front, it actually will refer into the back and into the middle back, which can look very biomechanical. So this is something that we would use to make sure that this isn't a problem originating from the lungs. So obviously when Tim is sitting here, you can see his shoulder blades are in my way. So I'm going to ask him just to cross your arms over your chest, and I'd like to keep your arms in that position, please, for the majority of my testing. So I'm going to start with observations. If somebody has got a really acute infection, a lot of times you're going to see differences in how they breathe. People start to use accessory muscles. So they would use their traps and start to breathe like this. You can see scalene starting to tighten up. This is called your sternal notch. And a lot of times if I was really breathing in, that will pull in, or you might see it under the diaphragm, particularly with children, that starts to pull in. So we would look for those kinds of things. We would listen as well. If somebody is having an asthma attack, everybody I'm sure is aware of wheeze, which is where you've got an obstruction and you're forcing air flow through. You can start to get stridor, which is where here in the throat you're starting to get an obstruction and again you're forcing air through. If people have fluid in the lungs, like with pneumonia, then a lot of times they'll have a cough, and coughs can be dry and non-productive, but the kind of pneumonia cough has kind of got a wet, deep kind of gurgling sound. You might be able to hear some of those things when you were listening. So what I'm going to do first is I want to see how well the lungs are moving. So I'm basically going to put my hands around the level of T10 and I'm going to ask him to take a nice big breath. And you can see that my thumbs are moving nice and symmetrically and evenly. So let's say he had a fibrosis, which is scar tissue, or maybe he had a tumor, or he could have a pleural effusion, which is where you've got fluid building up between the lung and the lining of the lung, or even pneumonia, which could affect an entire lung, both lungs, or even just a section of the lung. Then I might see that they didn't move, or maybe I would see this as asymmetrical movement or a delay in movement, and all those would be positive findings. Next, what I want to do is I want to do something called tactile fremitus, which is a fancy way of saying to touch the vibration. So Tim, every time you feel my fist onto your back, I want you to say 99. Say 99.
99.
Thank you.
99. 99. 99.
So basically what I'm doing is I'm feeling the vibrations as he speaks and goes through, and he should have normal fremitus. If the vibrations were reduced, that would indicate that there was a blockage of some sort into the lung. So again, your pleural effusion or your fibrotic tissue or a tumor or something like that. But if he had pneumonia, actually, if you think about fluid, you can actually push a wave of fluid, can't you? And so if he had collections of fluid in the lung from pneumonia, you would actually start to get a hyperresonance and increased fremitus with that one. Next, what I want to do is I want to have a listen to what the kind of air fields sound like, and so that's called resonance. If you think of being in a church and you've got great acoustics, that's a resonant area, and that's because you've got a lot of air-filled space, and the lungs are exactly like that. So what I'm going to do, here's this vertebral column, and the lungs in the back, they kind of slope downwards on the diagonal. So I'm just going to tap through and have a listen. Now I want to make sure that I'm comparing each side against each other. So I'm trying to keep my fingers nice and symmetrical to have a listen. And I'm not going down to the base of the lung because the lung actually stops before the rib cage. So down here I would be working on kidneys and things like that. So I want to stay up around the T10 level. So I've listened here symmetrically in 5 steps like a ladder. I could also listen to the lateral lung field and compare, just to make sure that I was hearing normal things. And Tim sounds nice. So normal resonance, normal air-filled space. Hyperresonance is where you actually get an increase of air-filled space, and you see that in something like emphysema. The lungs should look like a tree, and then you've got the kind of leaves or branches going off, and at the end of those branches you've got things called alveoli, and they kind of look like grapes. But if you've got emphysema, the spaces that separate out the alveoli become destroyed, and instead of a bunch of grapes, it looks more like an apple, and that gives you more air-filled space, and so you would actually get hyperresonance. But again, if he had tumor or scar tissue or pleural effusion, things like that, then I would actually see dullness rather than the resonance. I would have a decrease in the resonance. Last but not least, I could have a listen. So when I'm auscultating the lungs, what I'm going to do is I'm going to ask Tim to take a nice deep breath for me. And again, I'm basically having a listen in the same points that I did percussion on before. Now, I'm not going to ask Tim to keep doing nice big breaths for me because I'm not actually doing the exam on him and that he'll hyperventilate. So what I could do is if I was just having a general interest, I could just have him breathe normally and then explore the area if I heard an odd sound. But again, I'm going down 5 points to get the good air-filled space all across the lungs. And then I would be going to the lateral aspects and comparing them, 2 on each side, so that I'm getting a really good listen in. Okay, and that there would be the simple respiratory screen. Thank you very much. I hope you found this interesting.